Hi, good morning. Hi, Soumya. Anumol came, good morning. Neetu, good morning. Donna, good morning. So, good morning, all. Yeah, I'm Varghese Thomas from Jeremiah International Academy, Calicut, and Mysore. Today, this is another video with a writing session. As you all know that last week we discussed about a writing task and the basic criteria, and today in which the one of the major criteria, or else we can say the lot of candidates has concerns regarding the organizing of a writing task. So here in this video, and we are discussing about how to organizing a question paper of Mrs. Maria Stephen. I hope you all received your question paper with our posters itself and on your WhatsApp groups and along with FB. And in this video, that is totally discussing about a case note and how to organize your letter, and all these things will be explained clearly. So definitely this will definitely going to help you how to organize this letter. And as you all know that organization is the fifth writing evaluation criteria, and this evaluation criteria is something is very important that majority of the candidates are losing their marks. And as like any other criteria, as you know that there are 6 criteria, and out of the 6 criteria at least you should implement 5 criteria on your letter, then only you would be able to crack your B grade required scores on your examination. So that is very important, in which this organization and layout as another important sessions where you are getting through on your examination. So how to organize a letter, alright? So this is another important questions from every candidate we receive. In between, Tanya, John, Matthew, Anshu, Saupanika, all good morning. Lintu, good morning. So if there is any concern, please feel free to ask and we'll definitely help you. And I hope you all received the question. And what do you need to do that? You just read the question. So I'll give a 2 minutes time. So for which what you can do that, please read carefully the question paper which we shared already, and during this time if you have any gentle doubt you can ask me and we can discuss that immediately. And during this 2 minutes just roughly read those who haven't gone through with your question paper, and I hope this will help you to understand what exactly you need to require or what exactly you need to focus on, or which area you need to focus on, what kind of history that you need to consider for the question on this. And I'll just read out the question those who haven't gone through with it. So as you know that whenever you receive a question paper, it is very important that you need to read the writing task. So because from the writing task you will be getting a 4 major important information, that is what type of letter you need to write and to whom you have to write, that means who will be your intent recipient, and thirdly what is the address of the recipient, finally what is the purpose of the letter. So this much major important information you will be receiving from your writing task, since that is the important or that is the most important area which you need to read it immediately when you receive a question paper. Alright. So hi Joji, good morning. Pavel, Carol, good morning. Binsi, Usha, good morning. So we'll move on to the writing task. Using the information, the case notes, write a referral letter to Miss Susan Parry, charge nurse at Helping Hand Rehabilitation Center, Eagle Vale, Sydney, NSW, where Miss Stephen will be taking care in your answers. Because when we ask to read the writing task, the majority candidates will not look into that's information which is after your case note, after your writing task, that is expand the relevant case note into answers. Do not use note form and use letter format. So this is the important criteria or important information which is given after the writing task. So from the writing task we came to know that we're using the information, the case note, write a referral letter. So we came to know that it is a referral letter. To whom we are writing? Susan Parry, charge nurse at Helping Rehabilitation Center, Eagle Vale, NSW, where Mrs. Stephen will be taken care. And in your answers, so and so we have already discussed. From which we are trying to move on the case note, how to write your letter. So it is very important, and we'll just read out the question paper, and there we need to understand how you should organize your letter. Alright, so how you should organize your letter, that is very important. And on your organization, the last time when we discussed with another writing task, we told about the 4 questions which you need to keep in your mind when you read the question paper. What was the question? The first one, those who have not attended the last time, so for them I'm just repeating. The first question is, to whom you are writing the letter. That means who is your intent recipient. Alright, and the second question is, what is the purpose of the letter. Immediately when you looking into the question paper, these 2 questions are highly important that you need to look into. That is the firstly, to whom you are writing the letter. Secondly, what is the purpose of the letter. If you could understand, or if you could pick these 2 answers from your question paper, then 100% I can say that your letter format and the organization will be perfectly correct. Alright, so if you could understand these 2 questions answers from your case note, then definitely your answer sheet, the whole answer sheet will be perfectly correct. Because as you know that on your first paragraph, that is in the introduction itself, your purpose of the letter should be mentioned. Because last day we told about the early mentioning of your purpose on your paragraph, so that is very important. So when you mention your purpose of the letter in the paragraph, first paragraph itself, then if you could understand to whom you are writing the letter, with those 2 information will be more enough to understand what is the organization of your letter. Based on this 2 questions, if you clearly got from your question paper, that means when you consider the purpose of the letter, you should understand behind the purpose and after the to whom you are writing the letter, there is another point which is highly important. That is, what is a patient's main medical issues. So this is another area where you have to focus on very clearly why you are writing the letter. That means, for example, a patient has diabetes and hypertension, alright, and now you are writing to a diabetic nurse, then you should understand why you are writing the letter. So if you are considering diabetic and hypertension on your introduction, it is not actually required. Why? Because what is a patient's main medical issue, or what you consider that your patients to be referred to a diabetic nurse. So that is only because of his diabetic history, correct? Alright, so based on this information, you should understand what is a patient's main medical issue. Then only your purpose of the letter will be identified. So this is another important area which you have to focus on it every time when you are preparing a letter writing. That is, I'll just repeat it again. Firstly, you should understand who is your intent recipient. Secondly, you should look for what is a patient's main medical issue. There will be lot of issues will be by medically, but you should understand what is a patient's main medical issue. That main medical issue that you need to include on your letter, then only your purpose of the letter. For example, you are, as what we discussed before, the patient is diabetic and hypertension, but we are writing to a diabetic nurse for the purpose of managing her uncontrolled glycemic index. Alright, uncontrolled glycemic index. So when we preparing the letter, if your purpose is for further care and management, Alright, further care and management, patient require further care and management. But instead of, if you are writing diabetes and hypertension for the patient, and if you are requiring further care and management as a purpose, then you can understand, the reader will able to understand from your letter that the patient has diabetes and hypertension, both further care and management the reader has to provide. But actually, what is a question demands, that's what we require to know. That is something, the patient has uncontrolled glycemic index. That is the reason, because you are referring the patient, so then definitely you should know why or what is the main medical issue. So if you are including patient has uncontrolled glycemic index and requires further care and management, then obviously the reader is very clear about it and he should follow. That means the reader should focus only on her uncontrolled glycemic index, not with the hypertension. And additional information you would have been given with that patient has hypertension. Is that clear? So this is the way that you need to understand, or you need to secure with your first paragraph, that is the introduction paragraph of your letter. So this is something which you have to focus on when you are preparing the letter. So I always recommend that after writing the introduction paragraph, you should give seconds of time for looking into whether your introduction part is correct or not. And if you are 100% sure that your introduction part is correct, the introductory paragraph will give you the maximum mark, that is 0 to 3 marks. Out of that you will get 3 marks perfectly, and that is our guarantee that definitely you will receive your maximum score on your writing. Alright, so this is very important. And now when we comes into this writing task, so I just given a title itself, that organization of ideas. So how to organize an idea from your question paper, how your paragraph. I hope you all have prepared this letter, this question paper, and transform into your answers. So this is something is going to help you when you are acquiring this information from your writing task. So from the patient details, we came to know that read the case note below and complete the writing task which follows, in which your name is Susan Dean and you are the charge nurse on the medical ward where Mrs. Maria Stephen was admitted as a patient. Hospital name is Prince of Wales Hospital, and patient details: name Mrs. Maria Stephen, and gender is female, date of birth is given, and address, occupation, she is a retired accountant. She is married. Next of kin, Mr. Davis John. Mother died at 40 with cancer. Father died at 57 with coronary artery disease. Has 2 siblings. Brother age 79. So all these history is given. So you can also read from your question. So what is the history and how we need to organize a letter. So this is what we are trying to explain in our in this session, and I hope all will be benefited with this, and please try to focus on your answers, then only you would be able to understand. Those who haven't seen the question, I'm just displaying on my slides with the question paper, so definitely that also will be helpful. So far what it has been seen, that we already read, your name is Susan Jane and you're the charge nurse on the medical ward where Mrs. Maria Stephen was admitted as a patient. The hospital is Prince Wales Hospital. And further, the family history we already discussed, with her deceased twin sister with osteoporosis and depression. So each of the information when you read, this from the question paper, what do you have to do that, because the 2 questions which we already discussed, who is your intern recipient, secondly what is the purpose of the letter, third and fourth questions are yet another important thing when you have to focus on your question when you prepare the question paper. That is, the third question is, what are the information will be important to the reader, or what are the information will be relevant to the reader. So this is another question which is very important. And the fourth question is, what are the information will be non-relevant to the reader. Alright, so this is highly important that you need to focus on when you are trying to discuss with this type of questions. Is that clear? Alright, now when you read the information from the question paper, what do you have to do, that you should understand So what are the information are relevant and what are the information are non-relevant. So what do you have to do that? So when you're trying to do this, each of the information when you're reading from the question paper, when you scribble the question paper first during the 5 minutes of time, so what do you have to, each of the information you have to look into whether that is relevant to your reader. So for which you should consider yourself as a reader, not as a writer. Alright, so this is quite important when you are looking into the question paper. So this is what it's very important. Okay, so for example, family history you have to look into. Mother died at 40, cancer. Father died at 57, and so you should look into the, has 2 siblings, brother aged 79 with heart disease, twin sister with osteoporosis and depression. So all this we need to consider based on to whom you are writing and what is the purpose of the letter. Based on that you have to understand whether it is relevant or not, and based on you have to look forward. Social history, lives with the husband in own house, home has 2 stories and 2 steps to entrance, supports full bath on 2nd floor only, 2 grown children living nearby. Alright, these are the information which is given on the session. So I hope you can see on the screen. So what are the information which is given, and further when we move on it, so we can see that alright, that post-operative period, what are the treatment you have given, and each day by day, 28, 29 and 30th date which is given. So you can see that each of the information, what was the management which is given on there. So that will definitely going to help you like understand how much. And you know one thing, actually this case note is quite lengthy. Alright, there are a lot of information, each even day by day and several histories, and you can see that the patient was there for the hospital for almost 5 days, that is from 28/6/2018 to 2/7/2018. And the chief complaint was injury on the left hip, had a fall after sleeping. Alright, and what happened after that? Fractured left neck of femur, that is NOF, it is neck of femur. And on first patient, the PT, that is physiotherapy, continued, and complaining of constipation, note had a bowel movement since after the surgery. And Docozate 100 mg daily, can ambulate short distance with a walker, assistance with ADA. So these are the information it is given. And second, that is today's date. We all know that the patient discharge date will be considered as today's date, and from the question paper we can consider today's date as 02/07/2018. Original dressing changed, ready for discharge. And discharge plan, LLE, that is left lower extremity, and weight bearing limited to 30% of next 6 weeks. Elderly husband not able to care for her. On all these requires that our purpose of the letter has come in. Alright, now we'll just look into, so what are the information we'll be looking into the plan and what will be on our letter. So now I just give you 2 sets of answers. Alright, I'll just give you 2 sets of answer, in which what you need to do that, which is almost similar to your answer, you can consider. And if you require any more information, please feel free to ask me. So definitely we could explain you in more and more where there is a lacking or where you feel concerned. Alright, now as you know that how to do that, because on last sessions we made the address first, and this time we made the date first, because we just wanted to see that any format would be highly appreciated, because it doesn't have any matter. OET strictly recommends that based on your local context, what format you are following, that you can follow on your letter writing event. So it doesn't matter if you are writing date first or address first, no problem, that will not affect your marks. And date 02/07/2018, and you are writing to Miss Susan Parry, charge nurse, helping hand relief, rehabilitation center, Eagleville, Sydney, NSW. And reference Mrs. Maria Stephen, date of birth 25/12/1943, dear Miss Parry. So either you are putting dear Miss Parry first and reference second, both are fine because that is not going to affect your marks. And further, I'm just giving you the introduction paragraph. Just listen carefully and read from the screen, and that you can also understand what exactly the things are. So it should be very precise, and it should be apparent, and it should be legible to the reader, and the entire information that is very important of why you are writing the letter, the main medical issue which I have been mentioned early in the paragraph itself. Alright, I am writing to request rehabilitation care for Mrs. Stephen. Either you can write the full name of the patient over there, the introduction, both are okay, but highly they are recommending the complete name of the patient. So it doesn't matter if you are writing only second name, not an issue. I'm writing to request rehabilitation care for Mrs. Stephen, a patient of osteoarthritis. So now definitely you will have a concern of whether can I write a patient, client, all these on your writing. Definitely, if you are, what OET recommends that it has been not recommended to consider as a subject or a noun on your noun as patient on your letter writing. So other hand, you can do that as a patient of osteoarthritis, a regular patient at your care. All these kind of sentences or phrases you can use it on your letter writing. We are not directly replacing the noun with the patient, so directly you can use it. In other hand, osteoporosis, who is recovering from a left hemiarthroplasty necessitated by fractured left neck of femur. Alright, this is the one way of introduction. So either you can stop from here, or if you want, because since there are a lot of information on your case now, and majority it is highly relevant, and that is the reason because I just added the admission details also over here. She was admitted on 28/06/2017 and is being transferred to your facility today. Alright, so majority of the candidates has a habit of writing their admission dates on the first paragraph, that is first body paragraph after the introduction. So but here there is another change that you can implement on your further letter, because that will give you another format which is not a cliches. Alright, so I am writing to request rehabilitation care for Miss Stephen or Maria Stephen, both are right, a patient of osteoarthritis who is recovering from left hemiarthroplasty necessitated by, what necessitated, what made it to be necessitated for the surgery, that is left fracture neck of femur. Alright, is that clear? That is the reason because we require that information also in the, that is the main medical issues. Alright, or else you can do that presented with left neck of femur fracture, and she underwent left hemiarthroplasty, that is also perfectly fine. Or you can do that she underwent left hemiarthroplasty for fracture left neck of femur. Any manner would be best for your letter. So if you are trying with another sentence or new sentence, that also will help you to understand what exactly the letter writing or the introduction you need to focus on. I hope you are well clear with this. When we move further with the first body, I hope you followed all this introduction what we discussed. And when it comes to the further paragraph, so it's very important because patient underwent the surgery already, and her post-operative period, how it is getting into the sentence, that will be focused on it. Post-operatively, she responded well and was commenced on physiotherapy to promote strength and recovery. Alright, so we already mentioned that patient underwent hemiarthroplasty in the introduction. So it is not recommended that all patient underwent the surgery on so and so date. Again, if you including on your second paragraph, that is first body paragraph, it is not recommended that again you need to focus on such kind of information, because you already explained. You know one thing, most of the students use redundations on their letter. So you know what is redundation? The same meaning or same phrases with different synonym, if you're using in a sentence or in the paragraph or in a letter, that's we call as a redundation. So if you're using the redundation forms on your letter writing, then there are high chance of losing your marks on the letter writing. So try not to repeat the information or with the same meaning, or you are given the information. For example, most of the students will give the patient is married and lives with his wife, because when the patient lives with his wife, so we can understand patient is already married, right? So similarly, don't try to include such kind of a phrases which is already given the meaning on your previous sentences. Don't try to repeat it, because that is like, you know, that information particularly will not help you to achieve the marks. It will help you to lose your marks. So please don't try to do that. She suffered from constipation during hospitalization. For Docusate has been prescribed. So we can understand during the hospitalization on the second, which says that complaining of constipation, note had bowel movements in surgery. Docusate 100 mg daily, can ambulate short distance. So that particular information, it has been not saying that which is continuing. So what we can say that particular information we just closed, and that's the reason because we made it, and she suffered from constipation during hospitalization, for which Docusate 100 mg has been prescribed, so that you can do that. And further goes, currently Mrs. Stephen can ambulate short distance with a walker, and her LLE, what is LLE? Left lower extremity weight bearing is limited to 30% for the next 6 weeks, because that's the information is very clear. And you know, last time when we discussing the organization and layout, we were discussing the three pattern of writing the organization. What do you remember? What was that? The first one was the chronological order, second one problem and solution order, third one hierarchical method. On last letter we made not the chronological order, we made a problem solution organization. Here we are using the hierarchical method of organization, because the most important, what the reader requires, the most important information that we consider on the first body paragraph, and that's the reason because we included all. Do you believe all the patient social history, like patient mother had so-and-so disease, father has so-and-so disease, a twin sister, do you feel all that kind of things are important? So we don't prefer the chronological order, and it is not been having any particular problem on the each visit, because it is not a visit, it is a hospitalization, and so we can't say that it's a chronological or problem solution method. We can use it over here. So what we can use a hierarchical method, that is which the information the reader required with highly important, that you need to use in the first of the paragraph, and what are the information which is less important, that you please consider on the further paragraph. That is the reason because we could say that it is a hierarchical method which you have been focusing on your letter writing today. Alright, so this is the way that you should understand whether should I move on the chronological order. No, actually this is not event by event has been happened. Alright, so is that problem solution? No, actually it is not raising any problem, and we are managing with the solution with that which not been given, since it is a post-operative period. So what you have to do, that you should understand it should be a hierarchical method, because the reader is going to provide the post-operative management. Alright, post-operative management for further recovery. So what you can do, that you are given the information like based on the importance, or based on the importance which the reader should know, based on that only you are providing the information. So that is the reason because we are focusing on the hierarchical method of transforming your answers to your letter. And her home is not set up for a worker, and her elderly husband will not be able to care for her at home. So actually what is the situation? So you know, we already discussed in the introduction or the previous session itself. We told about based on the purpose oriented only your further paragraph should be. Here on the purpose we clearly mentioned that patient requires rehabilitation care. So why the rehabilitation care? Because patient has so and so difficulties and her home is not set up with friendly with walker, and her husband is so elderly, like he cannot provide the further care of the patient. So that is the reason because we are requesting a rehabilitation service from the nurse who is taking care of her after the discharge. Alright. So that is the reason because we consider all these information are highly important for the reader to know. Then only the purpose will be highly focused. So further information, therefore she is being referred you for further management. So that is the reason because we are referring this patient Maria Stephen to the Susan Pally. Is that clear? Now we further moves on the third paragraph, that is the second body paragraph. Following her discharge, please ensure her compliance with the recommended exercises program. Alright. Following her discharge, what are the things it is being required to know that please ensure her compliance with the recommended exercise program. Kindly also monitor her adherence to the medication regime, which includes her previous medication for hypertension and the hyperlipidemia. So this is another way. Yeah, in between I got an important query that Neetu. So is it okay to mention the patient in the letter? Neetu, I have already mentioned that don't ever use as a noun on your letter, that is instead of patient has hypertension and dyslipidemia, because that is making on as a noun or pronoun of your letter. Actually when you are sensing that the information, like for example I have mentioned that a patient of osteoarthritis. Alright, since the patient of osteoarthritis I am not directly mentioned as a pronoun, so you can directly use that in that kind of case. For example, I am writing to refer Mr. Peter John who is a regular patient at your care. So in that situation I am just mentioning, I am not saying that, I am not putting a pronoun on your subject. I am just mentioning that this is the patient who is at your regular care. Alright, so you can use definitely in this context, you can use it. Alright, these contextual writing definitely that will help you to identify. Okay, we'll back to the sentence. So kindly also monitor her adherence to the medication regime, which includes her previous medications for hypertension and hyperdyslipidemia. You can see this sentence. This is another way that I have mentioned that patient is a non-case of hypertension and hyperdyslipidemia. Is that clear? So anyhow you can use the sentences, but the meaning of that context should be clearly understood by the reader. This is what we need to focus on it. Is that clear? Okay. Then coronary heart disease along with those prescribed in the hospital. Additionally, please assist her in ADL and ensure that her dressing remains intact and dry until her staples are removed on day 14 at our hospital. So this is the way that you can mention your paragraph, second body paragraph. When we move further, alright, please contact with any questions. Her medication chart is enclosed herewith for your peruse. So this is a sentence which you can also use in your sentence if there is a lot of medication even which is need to be followed after the discharge. So you can use that. Here her medication chart is enclosed herewith. Please note that here with a single word for your per user. For per user means for reference. Alright. For your further usages, all this meaning will be on the sentence. So you can use a sentence. Definitely that will also help you to include the vocabulary, which will be helpful for to increase your score on your examination. So this is the way of the one writing, and yours sincerely, Susan Dine, Charge Nurse, Prince Wales Hospital. This is the one way of writing. If there is any question, please feel free to ask me on this time, or else we can move on to the further pattern of writing. So there is another organization which I have made on further letter. So I can also show you that how the letter will be So this is the introduction, but I don't think so it has been required any more explanation. I just given another introduction. Please look into whether your writings are similar to this or not. And I am writing to request rehabilitation care for Mrs. Stephen, that is either Mrs. Maria Stephen, both are fine, and who was admitted to our hospital on 28/06/2017 with a fractured left neck-of-femur, underwent left hip hemiarthroplasty and is scheduled to be transferred to your facility today. So this is another way of writing letter, and if you feel this is comfortable, definitely you can use this, not a problem. Which one will be fine for you, that you can use accordingly. Is that clear? I just read it again for you. I am writing to request rehabilitation care for Mrs. Stephen, who was admitted to our hospital on 28/06/2017 with a fractured left neck-of-femur, underwent left hip hemiarthroplasty and is scheduled to be transferred to your facility today. So some of you at least feel this is a long sentence, not a problem. You can even split into two sentences, that also will be fine for the introduction. Or if you are writing in a single sentence, that is also not a problem, because it doesn't demand any number of sentences should include in the introduction. So it doesn't matter if you are writing on a single sentence or into two sentences, both are perfectly fine. Alright. So I am just moving on to the further paragraph. Although Mrs. Stephen has been progressing well, she is currently dependent on a walker for mobilization, and her LLE, that is left lower extremities weight bearing, is limited to 30% for the next 6 weeks. Alright, so this is the information which I have given on firstly, because that is the reason, because the rehabilitation care is required, because I am just focusing each of my information on the paragraph to the purpose of the letter. Because what was the purpose? Because you are requesting a rehabilitation care. So why the rehabilitation care? This is for the answer for my reader, to my reader, because my reader can easily understand why or what is the importance of my purpose of the letter, that can directly from my each of the paragraph. Is that clear? Now, her home is not set up for a walker, and her elderly husband will not be able to care for her at home. Therefore, she will need your assistance with ADL until she recuperates. So recuperates is another synonym for the recovery. So you can use it either in the letter. So this is all, because now we learned a lot of vocabulary which you can keep on use on your letter. So this is all is going to help you when you are preparing a good letter, and that also give you the more marks, and that will also help you to identify how your letter will be. Alright, now we'll move on to the next paragraph, that is to ensure a continuing recovery. You are requested to ensure her adherence. So instead of ensure her adherence, you can even paraphrase the information. Adherence to the exercises program that was initiated by the hospital physiotherapist to promote strength and recovery. To ensure continuing recovery or to promote the recovery, maybe you can paraphrase it. You are requested to ensure her adherence to the exercises program that was initiated by the hospital physiotherapist to promote strength and recovery. Her staples are due to be removed on day 40th and at a hospital, and until then please ensure that the dressing remains intact and dry. So instead of ensure, you could have been used enhance. So that also will help you to do that. Monitor her adherence to exercises program. All these you can make the paraphrasing. Alright. So when you do this paraphrasing, this also help you to achieve the good score on your letter writing. That also will help you to gather at least good information from the question paper, and you can go for further. And in the context of a medical history, I don't highly recommend that you need to give a tagline over there. In the context of medical history, you can directly start it, but this is another way of writing. In the context of her medical history, she suffers from osteoporosis, mild hyperlipidemia and coronary heart disease. This is what we mentioned in the previous format of the letter, that indirectly we may say that the patient has a medical history of so and so. Alright, so any manner that you can follow it. And she also suffered from constipation during hospitalization. Instead of hospitalization, you would say that during her stay at hospital, and that will also give you another way of sentences. Kindly oversee. Oversee. This is another vocabulary which you can use over there in your letter. Kindly oversee her compliance with all the medication in her medication chart attached to the letter. So in the previous letter we discussed that the enclosed medication herewith for your perusal. Here we just made another way, that kindly oversee her compliance with all the medication in her medication chart, that is the previous medication and as well as your current medication after the surgery, and which is attached to the letter. So these are the information which is given, and please do not hesitate to contact me. Please do not hesitate to contact me with any questions or queries that you can use it. So please do not hesitate to contact me with any questions. Yours sincerely, Susan Dane, and charge nurse, Prince Wales Hospital. So these all about your writing task. I hope which is clear for you. And now it's a time for, if there is any queries based on this question or based on your any other questions, you may please ask me now, so we can have a discussion on it, how you have to focus on your further letter writings. And I just wanted to say that because today we received our February 5th exam results, so we got a good number of results for all the candidates who appeared for the examination, both doctors as well as nurses. So even if you require any further assistance, you can even further contact with us. We'll definitely help you. And those candidates are struggling, like there are any of the modules, please let us know. We will also help you, even though if you are not a student from our center, so that definitely would help you for that. And because since we are supporting with the both online and offline, and I just do repeat, if there is any doubts regarding based on this task or if with any other task, please let me ask, so we can definitely include all the consent. And now because I just received a query that I need to mention all the medications which is given in the right case now. Actually, it is not required that you need to write the whole medication, because just you can imagine that if you are using that hydrocodone, acetaminophen 5 by 30, 325 1 mg 1 to 2 Q4 to Q6 PRN, if the pain acetaminophen 325 mg, just imagine if you are including all these information, definitely that letter will be awkward. And so I don't request that you need to focus on each of the information over there. So instead of, you can do that, you can enclose the information over the writing task. That also will helpful for you to identify or to give the information regarding the letter writing, and it is not required that you need to focus on further things. So is there any questions or concern, or if you are clearly understood, that is perfectly good, and well that you have clearly understood about it. And we also can say that we'll definitely will be further on going with many live sessions with each of the module as per your request. So if you have any particular such kind of a topic or the request or any type of letter, that also we can include in our further sessions too. So if there is any concern, please let us know and we can discuss with that. And now I think that's all about your task explanation. And if there is any question, please let me know. Otherwise, I think it was clear about the writing task. And if you feel any particular concern, even otherwise you can even contact us personally. We will also help you with that, all concerns. and I hope it was helpful for you to improve your sessions even with the vocabulary and the sentence structure, because it was totally another writings, other way of structuring the organization, because it was totally avoided all the cliche formats, and we are totally focusing as per the basics of our exam categorization of OET. And if you have any concerns or doubts regarding on this, please let me know. I think there is no other questions. Okay, what Nidu again, what about this medicines? There is a long list of it, but here we have mentioned all that those prescribed. So how will reader come to know that about the prescribed medication? Is it okay to mention like this? It's perfectly okay with that, Nidu, because if you are writing, just imagine if you are writing all the medications over there in your paragraph, the word limit of the paragraph will be also exceeded than 200. On the other hand, that will be awkward if you are keeping on writing all the medications and putting comma in every time. That also not good for us. And like either the patient knows that what are the previous medication which she is using for coronary artery disease and hypertension, dyslipidemia, all those things, it's been very clear about it. So it is not required that you need to include all the medicines over there. Instead of, you could have been written with the listed medications are already enclosed here. So that is the way that you can do that. Lintu, Denny, ADL is fine to write. Definitely, you should understand what is the discipline of the recipient. Based on that, you can give the abbreviations over your letter. So if the reader can understand, because since who was that? Lindu, I think, asked the questions. Lindu, I just wanted to ask you that you are a nurse and I am also a nurse. So you understood what is ADL, right? Similarly, since your recipient is also a nurse, so she can understand what is ADL. So definitely it is not required that you need to mention like activities of daily living. It's not required that you need to expand. That is the way of that your understanding of the discipline of the recipient. That's highly important. And is there any other questions? If there is no question, I think and if there is any further queries, please leave a messages on WhatsApp and or in our FB, or directly you may contact us and we could definitely help you with that. And I feel that's the end of your sessions today, and thank you so much. Till we meet on further live session or with a further video. And please let us know if there is any particular topic which we need to discuss on a further session, that we'll definitely discuss. And if there is any suggestions or if somewhere which we need to focus much on, please let us know. We'll help you with that. Thank you, and bye bye for today's sessions, and we'll see you on next time. Thank you.